of sites in the body, for example, skin, bone marrow, intestines, tumors, etc. So these all are termed as a specimen. Specimen collection is a procedure of collecting a specimen and testing it in the laboratory for the purpose of diagnosis and treatment of diseases. Types of biological specimen. So as I told you in the previous slide, that a specimen could be whole blood, it could be serum, plasma, urine, CSF, seminal fluid, peritoneal fluids, or tissues or bones or muscles. It could be anything that is obtained from the human body. Handling and labeling of a specimen. So when we collect any specimen, we make sure that it is properly labeled and transported to the laboratory. Each specimen should be labeled with the name of patient, his date of birth, and date and time of collection. Now you must be thinking, why do doctors need to collect this specimen, as this is the duty of paramedical staff? Basically, when you're working at a hospital, or you sometimes have to collect the samples on your own. For example, in many hospital settings, the arterial blood gases and lumbar punctures are done by the doctors themselves. So this is really important that you have the knowledge of specimen collection. So let's discuss some rules of a specimen collection. First, you have to introduce yourself to the patient. You wear gloves. You clean the area with the antiseptic solution. All the equipments you need should be sterilized. You have to inform the patient about the details of the procedure. Make sure that you collect the proper quantity of sample in one go, so that you do not have to do multiple punctures, as it would be quite uncomfortable for the patient. So now the types of investigations you carry out on specimen. There are two main types of investigations, which are qualitative and quantitative. So qualitative investigations, as its name indicates, is it will tell you if a particular substance is present in the specimen, and the quantitative tests will reveal the actual amount of substance present in the specimen. So now you have to think of an example of a qualitative and a quantitative test and give your answer in the comment section below. Now we're moving towards the collection of a particular specimen, that is blood. This is the most widely used specimen for the diagnosis of a number of diseases. So how do you draw a blood sample? Drawing of blood sample from vein is known as venipuncture. There are times when you draw the blood from arteries, for example, when you test for arterial blood gases, but mostly we take blood samples from vein. The most commonly used vein for this purpose is cubital vein, which is present in the cubital fossa. So this is the arm, a pronated forearm. This is the cubital fossa, and this is the medial cubital vein from where you draw the blood sample. The technique of venipuncture. This is just the diagrammatic representation of how you would draw a blood sample. We will not ask you to do this in your exam, so don't worry about it. This is just to give you an idea of the procedure. So first you tighten the tourniquet above the elbow on the patient's pronated forearm. You palpate the cubital fossa for the median cubital vein. You sterilize the area from where you want to withdraw the sample or the blood, and you insert the needle into the vein. Sometimes you can insert the butterfly cannula, and sometimes you just insert the syringe directly. Both of them can be used. Different forms of blood to be analyzed for different blood tests. So there are basically three main components of blood which can be analyzed in the laboratory. These three components are plasma, serum, and whole blood. So whole blood is a portion of blood which has all the blood cells, including WBCs, RBCs, platelets, etc., and plasma. Plasma is that portion of the blood which has fibrinogen in it, while serum is the fluid portion of the blood without fibrinogen. So this is the main difference between serum and plasma, that serum does not have fibrinogen in it, while plasma has fibrinogen in it. We sometimes ask you this difference in the examination, so you have to keep that in mind.